every phase of the way we respond to an emergency has had to change, starting with the way we intake calls. Our dispatchers have had to change the order of questions that they answer. We've had to adapt and put in new customized question and trigger tools that would indicate to them, okay, this is a possible COVID. That would trigger sending an alert to the crew, to use the extra PPE and those sorts of things. Responding to the call itself, right? I mean, upon arrival, about donning the proper PPE. As we've learned more through this event, right? We've learned more about the virus itself, and so there's been PPE changes. We've had to adjust in the types of disinfectants we use, in the types of equipment that we use. We've even had to make changes in the way that we would treat, say, for example, asthma. Right? Normally, in most cases, one of the first line medications we would use would be a nebulizer, right? And to give some sort of bronchial dilator medication to help open up airways. Well, the last thing you want to do with an airborne virus is aerosolize it, right, in a confined space. So our medical directors and working with other physicians at hospitals, and we've had to come up with protocols to give IV medications that can do the same thing to reduce the risk of spreading the virus via aerosolized. So that's just one example. There's actually lots of examples of things we've had to do. So the bare minimum for our guys right now would be to wear an N95 mask. So not a surgical or a cloth mask like these, but the actual N95. And then some form of eye covering, whether that be eyeglasses or a face shield. But they have to have something on. And then if it's a suspected COVID case, where it hit one of our triggers on call intake, or they have one of the signs and symptoms, then they would also add gowns, right? And a face mask would be on top of if they were already wearing goggles. The biggest thing we want people to understand is EMS is here to treat medical emergencies, right? Medical and trauma emergencies. So we need people to call, right? We're starting to see, we haven't seen statistical evidence of it here, but we're starting to hear about it in other parts of the country where people are avoiding calling and using EMS or going to the emergency rooms, and we're seeing spikes in things like heart attacks and deaths from those sorts of things because people are basically avoiding healthcare. So it's important people understand that you do need to call 911 if you're having an emergency. If you're having a stroke or trouble breathing or somebody's bleeding, right, those types of things, that's what EMS is for, right? And even the shortness of breath, right, and those sorts of what we don't want people calling us for, or I should say, what can hinder our ability to keep responding effectively for everybody, is when people call us for things that are not emergencies, right? When they call us because they've had an onset of a fever or something along those lines, right? Just simply having a new onset of a fever is probably something you can call your physician over, and take care of. And if you really feel like you need to see somebody, then if you're capable of driving, you should probably drive yourself.